Did you know that good sleep is necessary for optimal health and can affect hormone levels, mood, and even your weight? Are you getting enough sleep? Well, chances are you might not be. So, how do you know if you are getting enough sleep? And is it quality sleep? Well, on today's episode of Healthy Connections, we'll be discussing a wide variety of sleep disorders, including snoring, sleep apnea, insomnia, sleep deprivation, and restless leg syndrome. Hello and welcome to Healthy Connections. I'm Annetta Wilson, your host. Healthy Connections is a show dedicated to exploring a wide variety of topics, from prenatal care to Alzheimer's disease. And we do so with a wide variety of perspectives, from the professionals that help treat the syndromes to everyday people like you and me who may have personal experience dealing with these topics on a first-hand basis. Stay tuned and stay awake for Healthy Connections. Dr. Karen Tipernaney and Dr. Jeffrey Phillips are with Ear, Nose, Throat, and Plastic Surgery Associates here in Orlando. They're here to begin our discussion of sleep disorders, conditions, and various treatment options. Thank you for being with us, gentlemen.
Thanks for having us.
Sleep disorders. I mean, we hear we should get, 8 hours of sleep a night. Sleep is important to your health. How important is it? If you don't get enough sleep, what are some of the bad things that can happen?
Well, sleep is critically important. Just like food and water, the body needs sleep. And if we don't get the sleep, bad things can happen too. And sleep is a time for the body to regenerate, both physically and mentally, cognitively, so we can make sure we process the thoughts from the day. And you start to break down after a while when you don't get sleep. One of the most important things that happens if you don't get sleep is you can be susceptible to lots of infections, lots of different illnesses, and it can certainly worsen illnesses that you currently have as well. So very critically important to have sleep.
So all of those people who brag, oh, I only need 3 or 4 hours sleep a night, they're really not doing themselves any favors.
That's correct. You can get away with 3 or 4 hours of sleep for a little while, but they probably start to notice it catches up with you after a while. Start getting illnesses more frequently, start not being able to function as clearly as you used to, and some of the other problems, medical problems they might be having, just get worse over time too.
So what is sleep apnea? I mean, we kind of think we know what it is, but medically, how do you define it?
Well, sleep apnea is one of the sleeping disorders, and it's one of the more common ones. Sleep apnea is a result of your body not getting enough oxygenation while you're asleep. Normally, when you're awake and alert, your muscles and body have a certain amount of tone to them. But when you go to sleep, those muscles have a reduced tone. When that happens, structures like the tongue or the back of the palate tend to want to collapse into the back of the throat in certain individuals. When that happens, there's decreased airflow to the lungs. And obviously your body needs adequate airflow for you to have good oxygenation of your body. If that's not happening, then you have a problem. You have an obstructive apnea. And if that's happening to you on a regular basis, then that can lead to other comorbidities later on in life.
Comorbidities such as?
Such as you're higher risk for cardiovascular disease, such as high blood pressure, higher risk of heart disease, higher risk of stroke. And this can lead to secondary other problems, diabetes. So there's a variety of medical issues. If untreated, an individual is at higher risk for.
So this is no lightweight matter if you're not getting enough sleep. This is the doorway to a lot of serious problems down the road. How do you treat sleep disorders? And I want to continue talking about some of them, but what are some of the most common treatments for people who either have sleep apnea, or does that automatically mean you're a snorer as well?
Oftentimes people that have sleep apnea also snore, and
Okay.
snoring is usually a sign of partial airway obstruction.
Okay.
There's a number of people that snore. Almost 40% of the population has some snoring at some point in their life, but that doesn't necessarily mean you have sleep apnea. It can be a sign of sleep apnea, though.
So the only way to really check it is to have a sleep study done?
Yes,
Okay,
to be able to know for sure.
And we'll talk about that, but I want to get into some of the others. Narcolepsy. Define narcolepsy.
Narcolepsy is a different kind of sleep disorder. It's a disruption of the sleep-wake cycle. There's different kinds of sleep. The restful sleep is called REM sleep. A lot of people know that their REM is a very restful, helpful kind of sleep. And when you have intrusion or invasion of REM sleep into your day, you get these things called sleep attacks, where you can have symptoms such as just needing to sleep in the middle of the day, or falling asleep at times where you should be awake, falling asleep at the wheel, and sometimes even episodes where with extreme excitement or emotion, you get weak in the legs or get weak in the knees or fall over or even pass out, and that's called cataplexy, which can go along with narcolepsy as well.
Wow. So before we continue with that, I want to talk about some of the treatment modalities. You brought some things here, so tell us what we're looking at.
Sure. Well, one of the props we have here is one of the first treatment modalities for sleep apnea, and many people decide to try to use what's called CPAP, which stands for continuous positive airway pressure. And as Dr. Tipernini was talking about the airway closing off and blocking, this provides positive air pressure to be able to open the airway and be able to get that oxygen where you need it to be able to breathe, and so you can have much more restful sleep.
And it fits over the nose?
Yep, these are two different kinds of masks, if I can just use this as well. One of the more common masks is a nasal mask, and this actually just fits nice and comfortably over the nose.
Okay, and it
just like
forces
this.
air in.
And it forces air in through the nose.
Okay.
The other kind of mask that we have here is called a full face mask, and that goes over the nose and mouth just very comfortably like this. And the masks nowadays are much more comfortable and much more usable than they were many years ago.
What's the biggest difference someone might notice after using one of those, either of those?
The biggest thing that they'll notice is that they'll have had one of the best nights of sleep that they've had in a long time. They'll feel that they're refreshed, they're able to get nice, calm sleep, and they feel they're ready to start the day.
Okay, and there's something else that you have there.
So for obstructive sleep apnea, the gold standard for treatment is using the CPAP mask. So, and if you can use that on a regular basis, nightly, essentially for the rest of your life, then you're essentially cured of your sleep apnea.
Okay.
And so if you're using that, that's what's recommended up front.
But you have a mouthpiece.
Exactly.
there.
So about 50% of, 50% or so people don't tolerate CPAP mask. So what do you do in those individuals that can't tolerate CPAP? Well, then there's some alternative treatments that help in some people, and so we have some options. One is an oral appliance, and that's what this is here.
So does it basically force your mouth open?
Yes, so this works by two mechanisms. One is to keep the mouth closed. What that does, when you keep your mouth closed, the jaw stays closed as well. When that happens, that tends to keep your tongue from falling back as easily. And this also, the one particular one here, has an adjustment screw that once your mouth is closed, we can adjust it so to bring the jaw forward a few millimeters to give it a little more advancement of the tongue.
So what if neither of those works? Is surgery an option for some people?
Yes, there's many different surgical options that we can discuss, depending on where the level of the obstruction is. And one of them is talking about surgery at the actual palate. A lot of times snoring and actual obstruction happens at the level where the uvula hangs down in the back of the throat, and we can do various surgeries on that to open up the airway as well.
One of the things we were talking about this earlier, parasomnia. We've heard of insomnia where you can't sleep, but parasomnia, tell us about that one.
Parasomnia is a group of uncommon disorders of abnormal activities that happen during the night when you're sleeping.
Like sleepwalking?
Sleepwalking is a parasomnia. Sleep talking is a parasomnia. Grinding your teeth, or called bruxism, is a parasomnia. There's even something called sleep-related eating disorder, where people wake up in the middle of the night and not really are awake, but in a dream-like sleep state, and they find themselves in the kitchen and they're eating various kinds of irregular foods or things that you wouldn't normally eat during the day.
Amazing. And so really the only way to find out if you're not getting enough sleep, and we all know you wake up in the morning tired, you're kind of foggy, is to get a sleep study, and that's when they measure what happens to you when you're sleeping.
That's correct.
We could talk about this forever, but we don't have forever, so we want to let people know that they can contact you if they have any questions, and maybe set up a sleep study, because getting enough sleep is literally a matter of life and death.
I would agree with that.
Great. Doctors, thank you very much.
Thank you.
Thank you very much.
We will be back right after this. Don't go away, there's more. Now we're going to shift our discussion on sleep disorders to Dr. Jeffrey Lehman, who's going to tell us how robots are helping us sleep better. I have to hear about this. Robots. What do robots have to do with helping somebody sleep better?
The Da Vinci robotic system is a system that enables a surgeon to be able to get into tight places, visualize at different angles that would be possible with normal line of sight surgery, and have instruments that are wristed that can move in different ways in tight confines.
When you say wristed, you're actually
It's
talking
almost
about
like a
the
human
robot.
wrist.
Okay.
The end of the instrument will move like this, so it allows us to get into some spots and move in different ways than we would be able to without the robotic instrumentation. And so it allows us to do some procedures that really weren't possible before with as great an accuracy and safety.
Now, when we talked to your colleagues, they showed us the CPAP machine and the apparatus that goes inside the mouth. When is the point at which you recommend surgery?
With the surgical options, we always want to make sure that somebody has tried CPAP first, and that's for several reasons. CPAP is still considered the gold standard as far as treating sleep apnea syndrome, and if someone's able to tolerate CPAP, it's really an effective way to help support the entire airway during sleep. Surgery addresses points in the airway. We can't address the airway in such a comprehensive way as CPAP does. And so we reserve that for people that really have tried CPAP and just cannot tolerate it, or for some reason CPAP just doesn't work for them.
Okay. Is there anybody who would not be a good candidate for surgery?
Typically, if somebody has a very mild case of sleep apnea, we would not recommend they go ahead with surgeries. Most of the surgical options are pretty painful as far as a recovery process goes, and there are some risks associated with them. People who are very, very overweight as well, too, they may not have as good a result with a surgical procedure. And the people that are favorable, on the other hand, are people that have definite anatomic issues we can see that affect the airway, really large tonsils, a real prominent base of tongue. Those sorts of things really make us feel that the surgical option would be a good route.
Now, I really appreciate your candor in saying that the surgery is painful. What's the recovery like?
For most of our procedures, we're taking out tissue in the throat area, tonsils if they're present, trimming some of the edge of the palate and doing some repositioning of the tissues back there, potentially removing tissue at the back of the tongue. All those areas are very sensitive, and even a tonsillectomy alone in an adult is a pretty tough recovery for at least the first week afterwards. We tell people they're going to need a week out of work at least with an adult tonsillectomy. When we're operating on more sites in the throat, the recovery can be even a bit longer.
So what excites you as a physician, as a surgeon, about this option as opposed to the other external options?
The nice thing about a surgical option when it works out well for somebody is that they don't need to carry the equipment around with them. A lot of patients, that's a real downside to CPAP treatment. It seems more natural to them after that. They oftentimes will be able to lose weight, and sometimes that's a more effective thing than someone who has a successful outcome with CPAP, so it can help them in a number of different ways.
Now, we talked earlier with your colleagues about the different kinds of sleep disorders. One we didn't talk about was restless leg syndrome, which surprised me as a sleep disorder. Why is that a sleep disorder?
Because it occurs during sleep. People will get into the stages of sleep and their limbs will start moving, their legs will move, and that can get to the point where obviously can disrupt sleep for their bed partner, but it can also awaken the individual themselves. And that's something that's typically treated medically by the sleep physician.
So let's talk about the medications, because that's one area we didn't get into. Are there some some standard medications that are prescribed for people who say don't want the surgery or don't want to do the CPAP option.
With restless leg syndrome,
But
there's
in terms of sleep disorders, period.
yeah, sleep disorders in general, when we're talking about sleep apnea and obstructive sleep apnea, there are no medications that can help with that particular condition. If somebody has insomnia, certainly that's something that can be medicated. And narcolepsy, when they're sleepy during the daytime, independent of sleep quality at night, that's something as well that can be medicated.
So let's really talk about the seriousness of sleep deprivation. I mean, many of us have heard that it is actually used as a form of torture, which tells me that some pretty bad things can happen when you don't get enough sleep. What are some of the things that people really don't take seriously when it comes to not getting enough sleep in terms of the problems that can ensue?
Yeah, one of the big things is cognitive functioning. If you're not getting adequate sleep at night, it can hold you down mentally as far as your level of functioning. It can impair memory, can impair judgment and reaction time as well.
So what would that look like during a typical day? Say if you're routinely getting 3-4 hours of sleep at night and you're trying to go through a normal day, what might you notice that's off?
Yeah, on the milder range of things, if it's not getting to the point where you're actually falling asleep in the office, you could be trying to work on a project, trying to concentrate on something, losing focus because of that, forgetting things that you typically would be able to remember, so it can significantly affect productivity. If it gets to the point where you're actually having sleepiness intrude on your wakefulness during the daytime, then it can go so far as falling asleep at the desk, falling asleep in the car. That's one of the things that we
really
ask people about, is whether they actually fall asleep at a traffic light, and it's surprising how often that answer is,
Really?
well, yeah, I've done that before in the patients who are sleep apnea prone.
Are you seeing, can you measure whether there are different age groups that have bigger sleep issues than others? People say 40 plus as opposed to the 20-somethings or even teenagers.
Yeah, we do tend to see it more as people age. Several factors, part can be weight gain. Part of it too is just change in our muscle tone that occurs when we're sleeping at night.
Now, picking up on that, when you do surgery, can you pinpoint specific areas of the mouth and throat that are causing the problem and leave those areas that are okay alone?
Yeah, that's a great question. When we initially look at a patient in the office, certain things can jump out at us, really large tonsils, a real prominent base of tongue. We're getting an idea at that point where we might want to focus our activities surgically, but we really don't know for sure until we can see what happens with those tissue areas during sleep. So one of our real prime ways of assessing what we can address surgically is to take patients for a brief trip to the outpatient surgery suite, have them administered a little anesthetic agent, usually propofol, which is a medication that'll put them into a moderate to deep sedation level, and then we use a flexible fiber optic scope that we pass in through the nose to observe those areas of anatomy while the patient's actually snoring and sleeping.
So you can get that precise.
Right, and then we'll grade that as far as which level is obstructing and to what degree.
Okay, well, Dr. Lehman, this has been fascinating because many of us, didn't know there were even surgical options to making sure we get enough restful sleep. And certainly all of the different kinds of sleep disorders have been an eye-opener. Thank you for joining us.
My pleasure.
We will be back right after this. Don't go away. Stay awake. Rob Dopp has had trouble sleeping practically all of his life until now, and he's here to share his story. Hi, Rob.
Hi.
So Dr. Tipernaney is your physician, and you opted to have surgery
That's correct.
Out of all of the alternatives you had, the CPAP, the piece that goes in your jaw, why did you decide to go the surgical route?
The CPAP actually made me feel claustrophobic, so it was real tough to get used to breathing in that. You know, the other device that Dr. Tipernini and I had talked about was the jaw thing, and we kind of talked about what the benefits of the surgery are versus that, and I chose the surgery.
Because you just wanted to get it done.
Just get it done.
So what was your life like before you got help for sleeping disorder? Have you always had a history of not sleeping well, or was this something that happened throughout as you got older?
In my early 20s, I had my first sleep study done where I was basically having panic attacks at night. I had insomnia. I was fighting sleep. I felt like I had stopped breathing at night, and the sleep study didn't go very well for me. It was really tough to do with all the wires and everything. So
Now we need to let people know it's not painful.
No.
They just, put wires everywhere to
Very
monitor your
uncomfortable for me.
breathing. Yeah, yeah. Nobody's shocking you or anything like that.
Very uncomfortable for me. So I didn't like being constricted, and I ended up just having a bad experience with it. And I told my wife I'm never going to go back. It's not going to happen. And then, just here recently in the last couple of years, the insomnia came back really hard. It was really unbearable. I would stay up 24 hours at a time.
Oh my goodness.
And then I would just ultimately crash. And so I went to the ear, nose, and throat. And we started talking about options, and then we tried the CPAP, and it just wasn't working for me. And I couldn't get past the sleep studies even with the CPAP. So
Okay.
So I fought it a little bit more, and then that's when we chose to do surgery.
So what was your experience with surgery like?
It was really rough. I'm not going to sugarcoat it. It's a very important decision to make, and it's something you can't take lightly. But the benefits of it are, I can sleep through the night. It was a very painful surgery because they do a lot of work at one time on you, and I had the UP3, so there was a lot going on.
That's the kind of surgery.
That's the name of it, and but the benefits kind of just outweighed the general risk of having surgery.
What was your real incentive for doing something about this?
I have a 2-year-old, and I want to make sure I'm around for him.
Yeah.
So
what's life like now? When you
Good.
look at your before and then your after?
Good. I honestly don't snore anymore, which was pretty wild. I used to snore like...
I'm sure your wife appreciates
Oh yeah, she
that.
loves that. So I don't snore anymore. I get a really rested night's sleep now. I did have to learn how to swallow again because it is a throat surgery, so they're down there working. So you have to retrain yourself to eat and drink and stuff like that. But your brain just takes over and does what it needs to do. So.
Now, did you have any other health problems that were directly related to the lack of sleep, and what's happened with those since?
High blood pressure. I've been on high blood pressure medication for approximately 6 to 7 years. We never knew what really triggered it. Mm-hmm. It was we always thought it was something that was hereditary or something like that. Because it does run in my family, and come to find out, I'm no longer on it ever since my surgery.
So the minute you had the surgery and your sleep got regulated, you no longer needed the
right.
high blood pressure
I'm
medication.
completely off.
Wow.
So
Do you nap now?
from time to time.
Okay. That was something that probably never happened for you before.
No.
So what would you say to someone who is in your shoes? They haven't slept for years, maybe only sleep 3 or 4 hours a night, but like, no, I'm not going to go through it. It's too much hassle. What would you say?
I would say definitely consider it. It's something just like any other surgery that you can have. You really need to, you just really need to be well educated with it, talk to your doctor, and then you can make a good educated decision on it.
Any regrets?
No, not at all.
It didn't take you long to answer that question.
No, no,
Okay.
no. recovery time is about 30 days on it, and after that you're
And
golden.
then the rest of your life, you're sleeping
was
great.
perfect.
And you said you lost weight too.
I ended up losing weight off it. So,
Okay. Well, thank you for sharing your story with us,
problem.
and we're glad you decided to be around for your little guy too.
all right, thank you.
Thanks, Rob. We will be back right after this. Don't go away. Getting enough sleep is a matter of life and good health. And if you're not getting enough sleep, you really need to check things out. Our doctors tell us 7 to 8 hours is optimal. If that's not happening, please go see a doctor. We want you to be around to enjoy all of your healthy connections. I'm Annetta Wilson. Thanks for joining us, and we'll see you next time. Sweet dreams.